things off for us, Dr. Ondra, research areas in this particular field are really keyed in on electronic health records, EHR right now. What's state of the art? What are you keenly aware of or focused on?
When I think about this, the question of electronic health records, they're not just for record keeping at this point. They're part of a data system for health that can bring data from not only electronic health records, but other sources that can be used to create new kinds of information that we've had in the past. So, that electronic paper record, concept, we're over with that, and we're moving past that. And so when you think about getting data in new ways, using artificial intelligence to analyze immense amounts of data, we can start to think about doing research for different kinds of things, both operational research and then what you think of as clinical research. So, an example of operational research is, how do you free up clinicians to actually take care of patients instead of being the data entry people? So things like ambient listening, I'm sure most people have been in offices now that's even present today. And so it's a chance for AI to use voice recognition to record a encounter with a patient, accurately put all that information in, while the provider can actually engage with the patient, talking to you directly instead of what you often see as, leaning over and typing on the computer. And so that frees that up. That creates a better doctor-patient or nurse-patient relationship and allows that to move forward more quickly. You can also use AI with health records to help get the right patient to the right place at the right time to do that more efficiently. When I think about it, one of the things I like about being at MITRE is we don't operate just in health. We operate FFRDCs across the government spectrum. Well, we can actually take a look at what are we doing with air traffic control? What are we doing with ground transportation? What are we doing with military logistics? And take those understandings, that experience, those capabilities, and look at how could we use those to accelerate some of these things that we're doing in healthcare. And so, instead of having to reinvent the wheel on all these things for health, how do we modify wheels that we already have? And that's just on operational. And then on clinical, how do you take electronic records instead of doing traditional research with a registry and entering all the data on individual patients, then trying to analyze it? Could we start to pull data not only from electronic records, but combine it with other data from wearables? My guess is a lot of people have watches that are already streaming data on their vital signs. There's purpose-built wearables that people can use that will provide data. Combine that with data from pharmacies, other sources, and we can start to look at how do we design clinical trials in new ways instead of just the traditional randomized controlled trial, which is a very difficult time and expense way to do things. How can we create additional ways to get accurate information? And then how can we use that information to identify which patients can get which treatments or clinical trials more effectively and efficiently?
Our audience will note that one of the earlier speakers in this program, Tim Boltz, told a story about his daughter and how she plays doctor versus how he played doctor when he was a kid. He had a stethoscope and some of the other tools. He thought it was really funny that his daughter had a laptop while she was playing doctor. That was amazing to me, and some of the benefits that you talk about there, really notable and evident when anybody is in their doctor's office these days. What kind of challenges, Dr. Ondra, big picture, do IT leaders have to look at with the sort of advancements in technology, in layering in those different sources of data? What do they have to think about that they really didn't have to think about before?
I think it's how do you think about what the end user of this technology needs to do their job more effectively. How does it help a patient understand what's going on? How does it help a patient access the system more effectively? The first iteration of electronic health records did a lot of really good things. It provided information more seamlessly. But what it also did was made providers, the data entry people, caused a lot of burnout, still does. You still hear doctors, including the one that I'm married to, talk about having the frustrations of having to do data entry and looking at records. How do we free them up from that? Use technology now to get to the next level, to where we're using it to free up providers rather than lash them to their laptop. And so that your daughter, hopefully it won't be your granddaughter, right? Your daughter will be able to put away that laptop for the most part and be talking to a patient, examining a patient, interacting, instead of entering data in those requirements. And I think we're on the verge of that. And that's a place that AI will truly help us create a better health system, one that really is higher quality, provide information back to the provider and the patient rather than them providing information into it.
Michael, I want to get back to artificial intelligence that he teases out there in a moment, but before we get there, data sources, you're on like the pointy end of the spear relative to those issues, particularly for the work that you're doing with veterans. Talk a bit about societal community data, how you layer those in to better help patients, better help the care experience.
Yeah, actually helping veterans transition is the sole reason why Unitas was created back in 2013. In fact, both of our founders are military veterans. Dan Brillman, current Medicaid director under Dr. Oz, and Taylor Justice, CEO, because they experienced firsthand the challenges that veterans were having transitioning into civilian life. And if you think about it, if you put yourself in their shoes, when a soldier's on base, they have all the resources readily available for them, things like childcare and healthcare. But the moment they transition, they're inundated with over 60,000 veteran service organizations. And the onus is on them to figure out how to navigate that. So Unitas was created to simplify that process by providing the infrastructure that allows organizations to collaborate around a veteran's journey. And so since we know that 80% of our personal health outcomes are determined by things like health-related social needs, providing better infrastructure and delivery capabilities leads to proven clinical outcomes.
Talk about responsible use of that artificial intelligence that you mentioned, Dr. Ondra, particularly in these federal health systems. Like, that's a bit of, or can be, a loaded term today. What does responsible use of AI mean in the healthcare field?
Well, the first question we always ask ourselves as we're looking at any AI tool, and every AI tool needs to be assessed individually, both when it's brought to the market, but then throughout its life cycle. Because one of the things that's different about an AI tool from a traditional medical device is, when you get a traditional medical device approved, it's pretty much going to be the same, and when you've changed it. The thing about AI is it's continuing to evolve as it's getting new data in. And so is that AI tool that you originally approved still operating in the same way? And so we're going to have to think about how we assess these over a life cycle and not just at initial approval. And so the big question is always, how much can you trust the information coming from it when it's working appropriately? And number two, how do you know it's working appropriately?
Life cycle is a really important word, in my opinion, for what he drew out there. Getting back to veterans, to the life cycle of their care throughout their work with the federal government, with the U.S. military. Are there different phases of that life cycle where they need to think about different things relative to their data? Michael, does it change over time?
Well, yeah, I think a veteran's journey never ends, whether they're in uniform or they're transitioning into civilian life. So it's important for us to to remove the barriers and silos as they look to get connected to care, provide more resources within their community. So data plays a huge part in that, just allowing healthcare providers that care for veterans, community organizations that care for veterans to proactively reach out and engage them for health interventions to lead to better outcomes before those needs go unmet and they become emergent and more costly downstream.
Research relative to cybersecurity, which has been a really common theme throughout this program. Where are the needs right now, Dr. Ondra? Like, what do we need to study in order to do the protection of PII better in the future as these tools advance, as, to your point, artificial intelligence starts to layer on there? What do we need to know now in order to do that better later?
Yeah, when I think about cybersecurity, there's some well-known approaches that we can continue to evolve and adapt into healthcare. Zero trust architectures are a common one. It's well known, and we see it in many places. And that is, you don't trust any device, individual, or source until it's proven to be trustworthy. And so how do we adopt that? Another thing is we look at research and using AI to provide any kind of information into the health system is how do you access that data and what's the governance around that? Who can access it, for what purpose, when, and for how long? And then we look at how do we bring that data together? Do we do it in one big bundle, aggregate everything in a single source? Or do we use a more federated approach where the data lives where it lives? You access it to get the information you need, and then only that information is taken on, not the data itself. All those approaches can help protect data and individuals. The other thing, though, in an AI world that we're so interested in is that's transforming so much of healthcare and society is what are the unique risks in an AI world? And so one of the things we talked about tools. When you traditionally think about cyber attacks, you think about somebody either locking up a system or pulling information out of the system. In an AI world where the tools themselves are evolving as they get new information, what's the risk of somebody inserting bad information that will corrupt the AI tool itself? So not taking anything out, not locking it up, but just feeding it bad data. So that's something that we take a look at and can leverage what we do from across the federal space, everything from national security to the public sector. And then the other thing is, how do you prevent a cyber attack from becoming a cascading problem through the health system? And we've seen that a couple of times. The Change Health was a company that had a cyber attack, and it caused billing and reimbursement processing problems throughout the health system. It cascaded, and the federal government had to step in, CMS, to really stabilize things until that got resolved. You saw an Amazon Web Services shut down that impacted and cascaded across the health system. So understanding how do we identify cyber attacks early enough to prevent them from cascading or interrupt the cascade once it's started.
I'd love for you to weigh in there too, Michael. You've been a champion for, better or more effective data sharing standards for a long time. What role does that play in this discussion?
Yeah, and I actually think that's the biggest challenge that we see in industry today. And in order to improve trust and drive improvements around things such as homelessness, suicide prevention, and clinical outcomes, key partners of the federal government need to be able to balance both data sharing and privacy in the hand-in-glove relationship. For example, today the VA could share information around their veteran populations to state VA agencies, but that's become extremely challenging. And the reality is, at the end of the day, the state VA offices have to endure additional workloads just so they can better understand their populations.
I'd really like to focus the remainder of our conversation on rural healthcare. Maybe I'll start with you, Dr. Ondra, and just say, what are the opportunities out there in the rural healthcare space right now?
Well, for rural health, there's a couple of problems. Just the obvious one, distance. And so there's all this promise around telehealth, but telehealth is only as good as your upload-download speed. And so when you take a look at rural health, healthcare doesn't exist in isolation. It's part of society. It's what you've talked about. It's part of a larger community. And so how do we look at rural health in a more holistic sense? How do we look at it from the FCC point of view, the healthcare point of view? How do you provide the rural population with the tools that they can actually use in the environment that they're in? Separate of all that are some of the stresses in the rural environment in terms of the mix of reimbursement and the stress that rural hospitals are under.
Can data and analytics better perform or better enhance those efforts, Michael?
Yeah, absolutely. And first, when it comes to rural health policy and the rural health transformation, I just want to give praise to the administration for improving funding. $50 billion is a major commitment. CMS is spearheading the rural health transformation, and there's a sense of urgency behind the program. And as we know, rural health is under immense financial pressures. Just over the past decade alone, more than 100 rural hospitals have shuttered their doors. So for us, right, this is a welcome opportunity to really drive better outcomes for the rural populations. And we really see two primary opportunities. First is around the data itself, being able to proactively predict and identify those that are in need so that they can be enrolled into programs. And we do this through what is known as a self-sufficiency score. So a self-sufficiency score is taking public data like census data, private data like consumer data, but then leveraging our platform. And so we have algorithms based on our 85 million historical connections to care that drives our data to be able to precisely identify those that most at risk within a population. So I think for both the states, they can use that as a planning mechanism as far as benchmarking where their population is today. CMS can also use that as a benchmarking solution too, to see the progress that states are making with this investment. And then I think the second opportunity is really all around providing the infrastructure so that state and local agencies, payers, healthcare providers, and community organizations all have the ability to communicate, collaborate, and coordinate whole person care.
Michael Tudum, Dr. Stephen Ondra, we got to leave it there, but thank you so much for your insights. I learned so much today.
Thank you.
Thank you for having us.